Hi, I'd like to introduce myself. My name is Christine Happel. I'm a social worker and the founding director of Village in the Ville. So in this presentation, we'll walk through a bit more information about the Village movement. Let's start by discussing some of the research findings that inform the Village model. We know that maintaining independence in one's home contributes to better outcomes in the areas of cognition, depression, and activities of daily living. Numerous surveys have shown that the majority of Americans do wish to age in their own homes. However, according to the Aging in Place American survey, only about 33% of respondents that have a desire to age in place noted that they believe it's going to be possible. And so this shows a discrepancy between our wishes and our belief that our communities are prepared to care for us. We also know that civic engagement and volunteering can reduce mortality, increase physical function, muscular strength, and levels of self-rated health, as well as reduce symptoms of depression and pain and increase our life expectancy. So opportunities to participate in and make a positive contribution to community are integral to our dignity and sense of purpose and relates to maintaining our health in these varieties of capacities. There's also a growing body of literature that identifies self-efficacy appraisals as an important psychological process that influences health and well-being across the lifespan. So older adults with high self-efficacy, or that belief that they have or can access the tools to make changes and move through the world, have fewer health risks and report higher self-rated levels of health and happiness. There's also a growing body of literature and research around loneliness and isolation. About 38% of those aged 75 to 84 live alone, and then that percentage increases as we get older. About 500,000 older people go about 5 or 6 days a week without seeing or speaking to anyone at all. And I think it's worth noting that living alone is not the only way older adults experience loneliness, and not all people who live alone are lonely. Loneliness can be increased by bereavement, loss of work, or poor health, but really assuaging loneliness or impacting it is not just about having random human contact. It's really about the quality of the contact that we're having and who we're having it with. So it's important to listen to older adults and learn about the ways they're experiencing loneliness before trying to intervene. And so based on the literature and what we're beginning to understand more and more about aging, the Village model has been shaped around some founding principles and elements that I wanted to highlight. So it intends to be beyond aging in home and really about aging in community. It's also, the model is meant to be grassroots, so driven by older adults. Choice is important for folks of all ages, and so that correlation between how empowered we feel in our choices, that sense of self-efficacy I mentioned, and our overall self-rated health is something that we consider when modeling this program. It's also founded in principles of mutual aid. So we promote volunteerism and mutually supportive network. And really is one of our archstones, noting that everyone's gonna have something that they can offer, and as well as everyone's gonna have something that they need. So the Village model calls us all to take stock in how we can contribute to community. And again, really thinking about that sense of purpose and contribution. The model considers social determinants of health, recognizes that factors at both the individual and environmental level are going to impact our health as we age. Factors such as residential segregation, discrimination, social mobility, work, education, income, and knowing that we're not all going to age the same. And then the model intends to be very collaborative. So as much as I wish, I don't specialize in every facet of aging, in every population, and every obstacle. but my work is really about building relationships with other professionals and community members to expand and connect our networks. And so, keeping what we know in the literature in mind and our kind of founding principles, I'll talk a little bit more about how villages specifically transition these into programming that we offer the members and participants of the village. So to start, social programming and health and wellness programming, as well as educational programming, is a component of the village model. And although the COVID-19 pandemic has certainly altered and shifted how we are connecting and gathering, we're still getting together either virtually or in person to meet and connect on a regular basis. We do health and wellness activities, yoga, tai chi. Here in this photo, you see members who have gathered for a walking club, and we're all holding our walking passports where we tracked our regular walks. But we have members that get together to learn Spanish together, to discuss classical music and have chats about philosophy. We also provide health discussions in partnership with students at OSU and other groups around the community. And then do a variety of social outings and activities. We share meals together, get coffee together, have craft night, play bingo. And then additionally, we have members that do some more one-on-one companionship, make regular buddy check-in calls, and groups that are signed up to provide meals and that more direct care if that's ever something that members need. Over the last couple of years, intergenerational programming has been a significant part of that social programming that we offer. Really, ultimately within the village, there's a place for everyone in the community. And we know that the opportunities to interact with different age folks have benefits for both the younger people and the older people. It helps keep stories alive and creates a greater sense of community in general. And then for younger folks, having less ageist insights into their other community members is beneficial. And so here we've done a lot of activities such as pen pals and brought old folks together to cook and do different craft activities. Here we have our intergenerational summer skill swap participants. And then when students are back in school, we do a tech cafe as well. So lots of opportunities to share and connect across generations. Volunteer assistance is another significant component of the village's offerings. For villages in Central Ohio, we offer transportation, outdoor home maintenance, minor home maintenance, companionship. Those are some of the primary buckets we might be working within, but then we have volunteers that do pet care, accompany members to medical appointments to take notes, maybe do some home organizing or downsizing. We're kind of always expanding our list, and really that is quite based on volunteers' capacities and interests and how they're able to engage. We work with volunteer groups and are always also building our pool of long-term volunteers as well. And really, the village is there again to be that dot connector. So learning about what types of services people in the community need, and then trying to find volunteers that can help fulfill those needs. As I mentioned, villages do transportation, and that's a significant part of the volunteer services that we offer. So we will link volunteers to take older adults to medical appointments, to run errands, to go on social outings. Because transportation is such a significant component of life here in Central Ohio. We also know that it's a common barrier for older adults. So Central Ohio Area Agency on Aging lists it as one of the top 5 service needs in the community. And Age-Friendly Columbus and Franklin County noted that about 77% of older adults who do not drive experience transportation barriers to complete activities on a regular basis. So in addition to linking older adults with volunteers one-on-one to do transportation, we've also created a couple of other options. So anyone 50 and over in the Clintonville community, for example, can take our community circulator that runs every Tuesday from 10 to 4 and goes to a variety of stops around the community, including our community center. And then we've also partnered with Lyft to provide rides to older adults when we don't have volunteers or other options available. And we're able to schedule those rides through Lyft's concierge platform, which helps alleviate the need for the technology to do that, and then also provides a little bit more security and safety in doing so. And one thing that I consistently champion about the village model is that it's flexible and meant to elevate the needs of the community and kind of evolve as those needs arise. So in support of that mission, we're always developing new and different partnerships. Over the years, we've collaborated with Age-Friendly Columbus and Franklin County, Central Ohio Area Agency on Aging, the Franklin County Office on Aging, and the City of Columbus, other village programs, the Ohio State University, and many, many, many more. And so I just wanted to go through a couple examples of collaborative work that we've undertaken. We did an outdoor home maintenance project where we were able to kind of link together resources to do some of the projects that volunteers can't tackle, like installing handrails, removing trees, cleaning gutters. And then we also did a project around emergency preparedness. And so created emergency preparedness buckets and delivered them to about 300 older adults around the county, and then also did a series of planning workshops so that not only did older adults have the supplies that they need, but they had really thought about what they would do in an emergency. And then during the COVID-19 pandemic, partnered to provide several thousand necessity bags to older adults throughout the county that included shelf-stable food, hygiene items, but then also just friendly notes of support and information and resources as well. We also partnered to provide a friendly phone line that's provided reassurance to older adults in those initial months of the pandemic, which were quite scary and nerve-wracking for anyone. Here in Central Ohio, there are 7 village programs. They primarily exist in and around Columbus and Franklin County, serving unique neighborhoods, but there's also a village that serves the entirety of Union County neighbor to neighbor. And each village is independent and offers unique services and opportunities that meets the needs of their community. The village model is national, so there are village programs that exist throughout the United States. And Village to Village Network is a national organization that helps connect villages across the country, provides resources to villages that are getting started, and offers an annual conference to bring together those involved in the village movement. So if you're interested in learning more about the model or in starting a village in your own community, connecting with any of the local villages or with our national network is a great place to start. I just wanted to end with contact information if you have any questions or want to learn a little bit more about any of the details that I shared today. So thank you, and hope you have a great rest of your day.